gonna assume I am live. Here we are. Welcome back. Oh, my screen is a blank there. Let me put something up on there for us. Welcome back to Anatomy and Physiology. This is my student hours here as I review some of the topics and go over the announcements here for my online and in-person classes for BIO201 here this afternoon / evening, right? So again, because this is geared for my online and in-person classes, I'll go over just some quick announcements here as we start into week 2 of the semester, right? So we're in here week 2 of the semester, kind of halfway through the semester. Give you the student view here of my Canvas as we go through it. Click into the syllabus. Now again, this is kind of my online schedule, so it might be different from those of my in-person students here, but you can see here we're right here in week 2, right? We're starting into the chemical level of organization. I'll show you where that is on your Canvas. Actually, I should kind of fix this, right? We kind of already started a little bit differently here in terms of our lab assignments. So this lab assignment is the one that you're working on now, lab assignment number 5, anatomical orientation. It is due a little bit later this week, right? It's due I think on Friday, but that's because we have towards the end of the week here, so the chapter 1 test as well. So you can see here that lab assignment 1, lab assignment 5, that is kind of the first ones are startup labs. 1 through 4 are your startup labs, get you oriented. But again, a big focus here of that first chapter 1 test is really going to be anatomical orientations and directional terms as they relate to the human body. So those are some of the things that you want to kind of key up on, as a matter of fact, because we're here. Let's take a look at kind of some of these questions here that you might see that we start to see here at the beginning of the week. As a matter of fact, let me give you a little bit of a description here as to what to expect. If I open up maybe one of my announcements pages here. Let's try that again. But here, let's take a look here as I start to open up a Canvas as I had previously, and you'll see that I'll go through my little test bank. I'll go through the item bank here. So here's kind of the keys here. Now, exam number 1, it's available, and I'll change that a little bit in terms of the corrections in terms of what we're looking at here as we go through it. Now, it's obviously not going to be due there, but you'll have for my online class, they'll have a period of time which it'll be available, and then it'll close. So it'll be available for a couple of days, and then they will have to take it and then close. But what we're looking at is going to be 50 questions. 1.5, excuse me, not 4.5, but 1.5 points per question. So we have a total of 75 points available on this assessment / exam here. This that will start here this week. Our first one, remember, it's over chapter 1. And so when we look at chapter 1, there's a couple of main topics that we talked about, and they revolved around kind of the levels of organization, They revolve around, again, anatomical terminology as well as anatomical directions. And so be prepared to see some pictures, right? You're going to see pictures of different things. But let me come here and let me just kind of preview some of these questions that you might see here on the exam as we can take a look. Give you a practice one. There. Let's see what this one is. I think this is the right one. Yeah, so give a little bit of a preview here. Throw it up here on the board. Throw it up here on the screen. So I gave myself a little bit of a preview as it relates there. So again, there's the short answer questions there. We're going to be looking at, this is, again, this might be a little bit different here. So let's take a look here. This might have some of the chemistry tissues there. So the big ones that we're going to be looking at, a level of language of anatomy, as well as, not histology, but we'll be looking at the language of anatomy. Let me look at a different one here. This is kind of an old quiz. If I go here, let me go to a separate course here. Where is it? Courses. Go for my last semester's course. Okay. So again, when you see on this week here, the end of the week here, we'll be looking at a quiz or a test here that looks into chapter 1, right? The intro to anatomy and physiology. Let's take the preview here. And so you'll have questions that relate to, again, this one says the blank system. So think about those the organ systems, right? There's the 11 organ systems here, the reproductive, skeletal, digestive, integumentary, muscular, urinary. I won't name them all here. But the question asks, the blank system forms the external body covering, right? Or the most external body covering. You would take the answer there and you would, I think you can get it there. Click it right in there, right? You don't have to type anything in. This is one of those questions. Again, 50 questions, a point and a half for each question, totaling us about 75 points for this assessment here. So then you go to and again, the key for here is the levels of organization or the structural hierarchy in terms of life. And so we can see all those questions here. The study of the small body structures, often too small to be seen there. So you can see that these questions, the study of organism system structures, is called blank. What is the best definition of physiology? And then the latter half of this exam or test here, as I click through it pretty as quickly or as I can, is going to relate to topics like, here we go, here, right? Your abdominal pelvic cavity. So identifying any of those abdominal pelvic sections. The next one here might refer to some of the anatomical terms and regions, right? So what is the anatomical term for this proximal region of the thigh here? Or the proximal lower leg region, right? Like these are the questions that you'll be looking at. Again, some more abdominal pelvic regions. So you click what is the name of that one, number 8 there, and you would identify it. What is the anatomical name for that region? And so this is, again, as you may see on your chapter 1 material, what you're going to see is, I'm going to pull up my slides. Actually, let's just go pictures. this, right? So there's also a list of these anatomical terms in your outline, but this is the reference, right? This is the reference that we're going to be looking at here, practicing in as many different ways as you can, whether it's using flashcards, right? That's a common way to kind of work on some of these rote memorization. You have one term on the front, whether it's kind of a common term like the thumb. You can see the thumb here. The thumb is referred to as the pollex. So you put the thumb on one end of the, actually zoom in a little bit more. You can't see that, can you? Pollex or thumb there. As well, you can start to identify these other structures like the hand, manus, and the like. So again, flashcards might be one, or even just practicing anatomy and in terms of the human body that we have, right? So you can follow around the clavicular region, the region of the clavicle towards the acromial, the tip of my shoulder. The axillary region lays inferior to that. The region of the armpit, continue down distally from the upper extremity, and you have the brachium and the, here you can follow along as I go. Might have to get a writing utensil here for me. But these are key concepts that we're going to really key up on in terms of anatomy and physiology really early on. So again, anatomical regions, being able to identify these anatomical regions, as well as directional terms. So what I mean by directional terms is, let me see if I can't, if I got that picture up here. Nope, not that one. Here, right? So directional terms is referencing whether it's, you know, the midline, also the mid-sagittal plane there, and then towards the midline is medial, away from the midline is lateral. You can see here the terms. I'm getting a writing utensil, bear with me just a sec there. This one here. And so what I was mentioning here is that there's a couple of terms, let me zoom in just a sec here, that relate specifically to the upper and lower extremities. And that is the terms here, proximal and distal. So you can see that the terms proximal, yeah, that'll work. Distal here, moving away from the trunk of the body. So as you move down the arm towards the hand and fingers, that would be referring to as distal. As you move, you know, from the hand to the wrist, up to the elbow, up to the shoulder there, that is proximal. The term there is proximal. And again, that really relates only to the upper and lower extremities. If we're talking about like the trunk specifically, right? If you're talking about references, I'll clear off all these and start again. If we're talking about references to the trunk, you're likely to use the terms superior and inferior, right? Superior being up, towards the head or cranial, and inferior being down towards the legs or caudal, right? Caudal means towards the tail. Didn't see that up there, so I couldn't reference it. But again, then towards the front is anterior. Along with anterior means ventral. So the term ventral means towards the belly. And so our anterior region is obviously towards the belly, versus the posterior region, which is towards the back or dorsal region. So not to confuse anybody here, I'm not here to, I don't want to confuse you, but let me see if I have a picture here of perhaps some of the differences in anatomical orientation as it relates to pictures. A little bit the nervous system, and more specifically like our four-legged friends here. So do I have a picture of the neuraxis? All right, I'm gonna have to open up my slides here. And so the concept here is that here it is right there. So you can see here, I'll maybe even zoom in a little bit here for us, particularly on this portion. Where is it? This is what I wanted. There we go. We can specifically on the dog first, right? So again, if you're talking about inferior, and superior will always be up, right? Superior up, inferior down. Figure out. I'm typing down, right? So I'll just put soup there for kind of a reference. Inferior there for a reference point, right? But specifically, terms like dorsal means towards the back or the back. So if we're typing in here the concept of the dorsal, so on this quadruped, this creature here, their dorsal region is actually superior, right? So this is the dorsal region. Maybe make it a little bit bigger. And this is the ventral region, right? Ventral towards the ventral direction, right? Towards the belly. So in the dog here, as we have an example, their dorsal region is superior, their ventral region is inferior. As well, their cranial region, right? Cranial region on the dog, that is, their cranial region is anterior. And their caudal region, which is a reference towards the tailbone, their caudal, or tail, I should say, caudal is posterior. Right, so the anatomical regions, the anatomical directions, as it relates to like our four-legged friends here, they have like the head that is anterior, the tail that is posterior, their back is actually up towards the sky, their belly is down facing towards the ground there, which is in contrast. Now that I mentioned all that just to bring us in contrast to the human, right? The biped, which stands on two legs, right? We won't worry about the brain because that's where it changes a little bit. But the biped here, in which, so their cranial region, we'll start from the cranial region, right? Their cranial region, or their head, cranial direction as well, I should probably reference that. The cranial direction there is superior. The caudal region, right? Caudal meaning towards the tail, or like your tailbone, is inferior. I'll bring that up just a little bit. There we go. The back, or your dorsal, right? If I was a dolphin, I would have a dorsal fin, right? A fin on my back, and that would be my and that would be posterior, right? And then my ventral, or my belly, ventral or belly, would be anterior. And again, we've already mentioned that the reference towards the arms is and legs, that is proximal and distal. So closer to the trunk of the body is proximal, further away is distal. And so these are some important concepts, because you can see here, this is a section that I took all the way from the nervous system, which is kind of the last chapters here of our book. But again, we still reference these, and it becomes a little bit more advanced because the brain does have a different orientation, right, than that of the move that back there for us. The brain has a different orientation than that of the rest of the body, but don't worry about that yet. And so now that we've okay, there's the last question there that you might see there. We'll exit my preview of exam or test number 1 that you guys will look at. Again, the big ones here are going to be, it's going to be as much understanding the regional terms and directional terms as it is knowing some of that basic biology concepts that you see in chapter 1, homeostasis, the levels of hierarchy, structural hierarchy, as well as metabolism. What else do I want to think about? The requirements for human life, the characteristics for life. Those are all concepts that should be reviewed upon before preparing to take that exam. I'm going to break this down here. I'm going to go finally times to wrap up this, an abbreviated student hours here as we start to get our semester underway. Is that you can see here our next, after this week here, our next exam will be 2 weeks away. So I give you the student view. If you click there on the modules, right, you click on modules, you'll see that chapters 2 and 3, I'll probably publish up chapters 2 and 3 here this evening. I'll finish up chapter 3 here this evening, but you can see here chapters 2 and 3, that test is scheduled for February 8th to open on February the 8th there. So, excuse me. Chapter 3 will be there shortly. You can see chapter 2 is already available. Hopefully we can get through that here this week. And then as you move on here from that, we will get into, there's your lab assignment, chapter 3, and we'll have the exam or the test for that at the end of week 4, I think it is. I think it's at the end of week 4 here. Yep, there it is. So the week that opens of the 8th, right? So the end of week 4 will finish up there with the material as it relates to the chemical and cellular levels of organization. So chapters 2 and 3 will be contained in this next one here. And then again, you can see that the next couple of tests here will include 2 chapters. So chapter 1, an introduction to the human body, really a good assessment piece to get us started on that basic biology as well as anatomical terms and regional terms. And then chapters 2 and 3, a review of chemistry. Chapter 3, cell biology. And then chapter 4 is really where we start to deviate from traditional general biology, really get into this specificity of the cells of the human body, tissues, these different tissues of the human body, and the integumentary system, which is your skin, hair, and nails. So you're going to be looking at the different cells of the human body as well as looking at the skin, hair, and nails on that chapter there as we take a look. But I think that's going to wrap us up here for this evening. I hope everybody is doing well, stayed safe through that wet weather. But I look forward to seeing all of your responses here in the next couple of days as we go over the anatomy and physiology concepts related to some of the basic concepts. And then the next part being, as we'll see here, the concepts of chemistry and cell biology. But again, I look forward to seeing your responses throughout this semester. Take care and